Hello everyone, we are the Group F from EDUC 104, code 7591. Together with my group mate, we will discuss to you the types of hearing impairment. So before we start, what we can say about hearing impairment. So hearing impairment occurs when there's a problem or damage to one or more parts of the ear. So now I will discuss to you the types of hearing impairment. So the types of hearing impairment is the following, which is the conductive hearing loss, sensorineural, auditory neuropathy, and mixed hearing loss. The next presenter will discuss to you the conductive hearing loss.
My discussion for today is all about types of hearing impairment. There are 4 types of hearing impairment, but I will just discuss the 2 of them. So these are conductive hearing loss and sensorineural hearing loss. Hearing loss is categorized according to which part of the function is impaired. A conductive hearing loss is caused by issues with the external or middle ear. Hearing loss caused by complications with the inner ear and hearing nerve is known as sensorineural hearing loss. The first type of hearing impairment is conductive hearing loss. It is a blockage of the external canal, perforation of the eardrum, infections and diseases of the middle ear, and damage or fixation of the small hearing bones may all cause conductive hearing loss. An individual with conductive hearing loss can hear better in noise than in silence and hears well on the phone in general. Conduction hearing impairments rarely result in total deafness, and a correctly fitted hearing aid will normally help. Conductive hearing loss occurs when there is a problem transferring sound waves anywhere along the pathway through the outer ear, or in our tympanic membrane or the eardrum, or middle ear or the ossicles. If a conductive hearing loss occurs in conjunction with a sensorineural hearing loss, it is referred to as a mixed hearing loss. So if the 2 impairments will join together, it will be called as a mixed hearing loss. The next slide is all about the causes of conductive impairment. So the most common cause of conductive impairment, especially in children, is fluid. And then the second one is foreign objects. Then allergies, ruptured eardrum, and impacted earwax. To sum it all up, conductive hearing loss makes all sounds faint or muffled. The hearing loss is usually worse in lower frequencies. The second type of hearing impairment is sensorineural hearing loss. Sensorineural hearing loss is more common and can be caused by a variety of factors. The disease usually results in the deterioration of sound receptors and nerve endings over time. A lack of sensitivity to sound as well as lack of perception or clarity of sound can be experienced by patients. Where there is background noise, speech understanding is difficult, and hearing sensitivity is normally best for low tones than high-pitched sound. Many people with sensorineural disability benefit from hearing aids because they enhance sounds. Hearing aids, on the other hand, seldom improve speech clarity. Hearing aids cannot be necessary when speech comprehension deteriorates dramatically. Many of these patients will benefit from a cochlear implant. These devices are surgically inserted and activate the brain directly. That improves the ability to hear sounds and the ability to understand speech. That's why when you observe a people with an hearing aid, it has a cord something like that is connected inside the ear that is used for them to hear clearly. The next slide is all about the causes of sensorineural hearing impairment. So the first one is noise. Hearing loss is common as a result of loud noises. Long-term exposure to loud sounds damages nerve endings and induces irreversible loss of sound receptors. The second one is aging. The majority of people lose of some of their sound receptors or nerve endings as they age. The impact of age-related changes on one's hearing varies greatly. The third one is genetics. In the development and maintenance of inner ear structures, genetic factors may play a role. Inherited influences affect not only the development of hearing loss in children, but also the development of hearing loss later in life. The fourth one is infection. Infections with viruses can cause hearing loss in both children and adults, with the loss typically occurring suddenly. The fifth one is autoimmune attacks. Hearing loss can occur when the body's immune system treats the inner ear as foreign tissue and attacks it as an invader. And the last one is chemicals. Chemical disruption, such as those caused by drugs or metabolic changes, may alter the composition of inner ear fluid as well as its pressure and volume. How can you prevent it? So there is a saying that prevention is better than cure. So you need to wear hearing protection to shield the ears from loud noises. Eat a low-fat, low-salt diet to lower the risk of chronic illnesses including heart disease and diabetes, both of which have been linked to hearing loss. Increasing blood flow to the inner ear with moderate cardiovascular exercise is a good idea. And lastly, to reduce the risk of inner injury, quit smoking.
Good day everyone, my name is Jessa and I will be talking about the third type of hearing impairment or auditory neuropathy. Well, what is auditory neuropathy? Auditory neuropathy is a rare type of hearing impairment or loss. It is because the symptoms of this can be caused by other common hearing impairments or the possible blockage or disruptions of our nerve endings, nerve impulses or signals from our inner ear to our brain. That is why people who suffer from this type of hearing impairment might suffer from mild to severe hearing loss and might have a hard time in understanding spoken words in a loud or noisy environment. Because of this, auditory neuropathy is sometimes called as nerve or neural deafness. The nature of this hearing impairment makes it hard for people who have auditory neuropathy to find treatments. It is because some treatments might work for some, but some might not be lucky enough for those treatments to be effective. Since we already know more about what is auditory neuropathy, it is time to understand the symptoms being experienced by people who suffer from this hearing impairment. First is the mild to severe hearing loss, and the second would be fading in and out sounds. Well, what do you mean by fading in and out sounds? The closest thing that I could relate to it would be when we are in a hall and we experience a faulty signal. We would hear our friends' words being spoken in a choppy way. It's like when you can barely hear anything or make sense of everything. That is what fading in and out sounds mean. Third would be people with this hearing impairment would suffer or have a difficulty in understanding spoken words because again, they would hear fading in and out sounds, especially in loud or noisy environments. The fourth symptom would be they would still have normal hearing, but they will experience a hard time in speech perception, which means they would find it hard to make sense of words being spoken to them. Fifth would be because of this, because of them having a hard time in making sense of speech perception, they would of course have a weak speech perception in loud environments or noisy areas. Since we already established that one of the main causes of auditory neuropathy is the blockage or disruption in our nerve impulses from our inner ear to our brain, it is time to understand that we are dealing with inner ear problems or inner ear parts having hard time functioning well or inner ear parts being damaged. That is why the cause of auditory neuropathy is the hair cells in the ear, or second, the damaged connection between the hair cells and the cochlear nerve. Third would be the cochlear nerve itself being damaged. Fourth would be the eighth cochlear nerve failing to receive the nerve impulses or signals from our inner ear and transmit it to the brain. Or lastly, the auditory pathways of the brain system is actually damaged itself. Alright, so how would someone know if they're suffering from auditory neuropathy? Well, there are ways to diagnose this type of hearing impairment. First, they would conduct a auditory brainstem response, or ABR, which makes use of electrodes in our inner ear and our brain. They would expose our ear to sounds, and they would see if the brain would create a wave pattern when it is being exposed to a sound. If there is no response, or at least if there is a little response from it, it means that a person is suffering from auditory neuropathy. Next would be the otoacoustic emissions, or OAE, which makes use of a tiny microphone inside the ear canal to check if the cochlear hairs or the hair cells are working. Well, how do we know if the cochlear hair is working? Well, the microphone will pick up a faint sound from the hair cells as they respond from noise or sound. Typically, a person with auditory neuropathy still have some proper functioning hair cells. Last would be other hearing tests or speech recognition. Generally speaking, a person with auditory neuropathy would perform poorly in this kind of test. Well, since we already talked about the symptoms, causes, or the diagnosis for auditory neuropathy, it is time to talk about the treatment options for auditory neuropathy. Well, it is to be kept in mind that these treatments will sometimes work or sometimes will not. It is depending to the person who suffers from this type of hearing impairment. The treatment options for this hearing impairment would make up of the cochlear implants, or another would be the frequency modulation system, or FM systems. Next would be hearing aids. But again, there is no guarantee that people who suffer from this hearing impairment or the auditory neuropathy will recover. They will sometimes experience deterioration despite having treatments.
What is mixed hearing loss? Mixed hearing loss combines features of both conductive and sensorineural hearing loss. This indicates that both the outer and inner ear have been damaged. The outer ear cannot adequately conduct sounds to the inner ear, and the inner ear cannot filter sounds to send to the brain. The sensorineural component, inner ear, is normally consistent, although the conductive component, outer ear, is not always. Many people will combine hearing loss described as sounds very quiet and difficult to understand. Cause of mixed hearing loss. First is the genetic factors. 50% to 60% of hearing loss in the babies is due to genetic cause. There are also a number of things in the environment that can cause hearing loss. 20% or more of hearing loss in the babies is due to environmental cause, such as maternal infection during pregnancy and complication after birth. Second is excessive noise, often from work or listening to loud music. Third is certain medication. Aspirin, when given in high doses, 8 to 12 tablets a day, is a common medication that can cause hearing loss. Fourth is birth condition. Most babies' hearing disorder is caused by genetics. Hearing deficiency can be caused by a genetic mutation by present at birth or occur later in life. Hearing deficiency genes may be inherited from either one or both parents. You and your baby can both hear perfectly, but you can both carry a gene that can cause hearing loss in your child. Fifth is tumor and disease. As seen in the picture, an acoustic neuroma, vestibular scleronoma, is a benign tumor that forms on the equilibrium, vestibular and hearing cochlea nerves that connect your inner ear to your brain. Hearing loss and imbalance can result from the tumor pressure on the nerve. 6 is head trauma. After a head injury, endrome or exocular chain trauma, disturbance of intralabyrinthine fluid, cochlea, or the 8th nerve can cause hearing loss. Tinnitus may also be caused by a neck injury. 7 is earwax. Ang earwax ay maaaring lumikha ng mga problema para sa ating pandinig kapag nagsimula itong buuin sa tainga. Isang proseso na kilala bilang impaksyon. Ang mga sintomas na naapektuhan ng earwax ay pagkawala ng pandinig, sakit sa tainga, pagpakiramdam na buo ng tainga, kati sa tainga, pagkahilo, pagring sa tainga at ubo. Ang pagtayo ng earwax ay maaring humantong sa pagkawala ng pandinig. 8 is ear infection. Karamihan sa mga infeksyon sa tainga ay hindi sanhi ng mga pagmatagalang komplikasyon. Ear infection that happen again and again can lead to serious complication. Impaired hearing, mild hearing loss that can comes and goes in fairly common with an ear infection, but it usually gets better after the infection clears. Treatment of mixed hearing loss. First is hearing aids can often help people with mixed hearing loss. Behind the ear, BTE. Style hearing aids may be prescribed option because their additional power is sometimes needed to address severe to profound sensorineural hearing loss. Second is cochlear implants are also an option that can be used to address the sensorineural aspect of mixed hearing loss. Third is conductive hearing loss can sometimes be treated with surgery, particularly in the case of tumor or blockage.